Hello everyone, welcome back to my channel. I'm Dr. Sisi. If you have ever wondered how conception really happens or how to know your most fertile days to increase your chances of getting pregnant, this video is for you. Today, I will explain how conception happens, how you can identify your fertile window, and how to calculate your ovulation. I will also be talking about healthy sexual habits that can improve your chances of getting pregnant faster. So if this is your first time on this channel and you haven't subscribed, please don't forget to hit that subscribe button and also turn on your notification bells so you don't miss out on future uploads. Understanding your fertility cycle is one of the most important tools you can have when trying to conceive. Let's break it down simply and medically. How does conception happen? Conception happens when a sperm cell from a male meets a mature egg from a woman. Here is the process. Every month, your ovary releases one egg, and this is ovulation. And this egg travels down the fallopian tube where it can meet a sperm. Now, if fertilization occurs, this fertilized egg travels down to the uterus where it is implanted into the lining of the uterus, and that is the start of pregnancy. Now, timing is everything. The egg survives for 12 to 24 hours, while the sperm can live or survive for up to 5 days in a woman's body. So what does this mean? It means your fertile window is not just one day. It's usually up to around 6 days per cycle. Now, how do you know your fertile window? Your fertile window usually starts around 5 days before ovulation and 1 day after ovulation. Here is how to identify it. So the normal cycle can range from 21 to 35 days cycle length. If you have a regular 28-day cycle, I'm using 28-day cycle as an example now. It means your ovulation day will most likely be on day 14 and your fertile window will be day 9 to day 15. What about if you're one of those people that have a shorter or longer cycle? That is, probably your cycle length extends for like 23 days, 24 days, or probably you have a 30-day cycle length. All you just need to do to get your fertile window is to subtract 14 from your next expected period, and then you get your most likely ovulation day. For example, if you have a 30-day cycle length, your ovulation day will most likely be on day 16, and then your fertile window may extend from day 11 to day 17. For example, if your cycle is a 30 days cycle, your ovulation day will most likely be on day 16. That is, your fertile window will last from day 11 to day 17. Now, what are the signs of ovulation? It is actually very important for you to know the signs of ovulation because this can help you in your conception journey. The body gives clues when you are ovulating. So it's important for you to know these signs and be able to identify these clues. So during ovulation, a lot of people might experience or notice a clear, stretchy vaginal discharge that is like raw egg whites, and this is a fertile mucus. What other signs can you look out for? Some people might experience lower abdominal pain around their ovulation period, and this is what we call medically as Betelgeuse. Other people might experience an increase in their temperature, probably around their period or even after ovulation. Others might notice increased libido or sexual desires around their ovulation period. So these are signs that you might be ovulating. Now, how do you calculate your ovulation period so you are able to know the best time to have sexual exposure? Let's use a simple method. First off, to be able to calculate your ovulation period, you should be able to know what your average cycle length is. So step one will be for you to know your average cycle length. And how can you do this? You can actually monitor your cycles for some few months so that you're able to know an average of how long your cycle length lasts for each cycle. Then the next step, after getting your average cycle length, You want to subtract 14 from that number, and that will be your estimated ovulation day. Thirdly, you want to count 5 days before your ovulation day and 1 day after your ovulation day. That will be your fertile window. Don't forget, we said the egg survives for 12 to 24 hours, while the sperm can live for up to 5 days in a woman's body. So your fertile window should be around 6 days. So how do you get the 6 days? You want to count 5 days before the ovulation day you've gotten and 1 day after the ovulation day. So take for instance your cycle is a 28 days cycle length. You want to subtract 14 from 28. That will give you what? 14. That means your estimated ovulation day is on day 14. Now, how do you now get your fertile window? 14 minus 5, that will be what? 9. 14 plus 1, that will be what? 15. So your estimated fertile window will be between day 9 to day 15. So all you just need to do is subtract 14 from your circle length and you get all these figures. You can also use fertility apps to automate the tracking and make it much easier. But it is also important to note that you might not know exactly when you will ovulate. So that is why we are using the word estimated ovulation day. So you might even ovulate. So take for instance your circle length is a 28-day circle length. You are expected to ovulate on the 14th. It might not even happen on the 14th. And that is why the knowledge of your fertile window is actually important. So that whenever date you ovulate, either ovulate earlier or afterwards, you are still within the frame. Now, let us talk of sexual habits that can actually improve your chances of getting pregnant. It is important to have sex every 2 to 3 days throughout your cycle. In fact, I tell my patients, on an average in a week, you should have sex about 3 times averagely in a week, especially during your fertile window. You also want to avoid use of excessive lubricants because this could actually slow sperm movements. You also want to try to stay relaxed and reduce stress because this could actually affect your hormone balance. You want to eat healthy, exercise, and reduce stress. You also want to avoid alcohol consumption, smoking, or even high consumption of caffeine. And don't forget, ensure you maintain a healthy weight. Remember, both partners' health matters, and the quality of the sperm plays a big role in conception. Now, if you have done all this, you have been able to understand your menstrual cycle, you've been able to know your estimated ovulation day, you know your fertile window, and you've done all this, you've been consistent with sexual exposures, and you still haven't gotten pregnant, then it might just be time for you to see a doctor. So now, if you notice you've been trying consecutively, consistently, following all these things for 1 year, and you've not gotten success, or you've been trying to conceive for 6 months, if you are aged 35 years and above, it is time for you to see a doctor because there might just be some structural or hormonal issues that might actually need to be treated. Conception isn't just about timing, it's about understanding your body. So ensure to track your cycles, adopt a healthy lifestyle, eat well, rest well, maintain a healthy weight, and be consistent. So thank you for joining me today. If you found this video helpful, don't forget to give this video a thumbs up, and if you haven't subscribed yet, please hit that subscribe button and share this to anyone who might be trying to conceive. See you on my next video. Bye.